Welcome to Talk 1260 KTRC. This is the Humanity Behind the Vanity. You're listening to Dr. Daniel Ronel with my wife Betsy Ronel. We're talking about plastic surgery and the realities behind plastic surgery. We have an interesting show today.
This week we're going to talk about the Botax, which people have been talking about all in the media and just around town, around the world. We're also going to talk about a privileged study he was able to do with the company Artifil. This week he's done it, and we're going to have Scott Thomas with a really wonderful tip for the Christmas season.
Right.
And also, to start this off, for those of you not decided whether you're going to do something for the next half hour or not, the Espanola Valley Humane Society is having an adopt-a-thon today.
As we speak.
As we speak. It started at 11 and it goes till 3 at the Chavez Center. There's a lot of puppies. There are going to be, I think, 3 purebreds, a boxer, of course I forgot one of them, and a lab, and there's going to be cats, and it's just a great time, and what better time of year to take in a lonely, sad creature than right now. Wrap him up with a bow and give it to your loved one. Yeah, they want you and they need you, and no one will ever love you more. No.
That's right.
Okay, so go over to the Genevieve Chavez Center, 11 to 3 today, and get yourself or your best friend or whatever a forever friend. But don't get it unless you're serious, because we don't want them back. We want them to go home with you and stay home with you and for you to love them. All right, on to the show.
Thank you.
Okay.
All right, Botax.
You mean this isn't about animals?
No.
Okay, sorry. Okay, Botax, tell us what this is.
At the 11th hour, at the right before the President Obama's health bill was submitted, something was added to it, which is a 5% tax on cosmetic procedures. This includes everything from teeth whitening to Botox to veneers, breast augmentation, maybe fillers. Who knows? Maybe permanent tattoos. Yeah, maybe. I don't know.
Oh, so we don't know the definitive answer for this.
I haven't read the whole bill, but there's enough in there for me to be really concerned, because if you look at who's getting plastic surgery these days, the average income, it's a woman with an income average of $30,000 to $60,000, $30,000 to $90,000.
$30,000 to $90,000.
And so to tax them is a little bit seems a little bit unfair.
But that's the middle class. The middle class is always heavily taxed, but that's what Democrats say, that they're not going to heavily tax the middle class. But here, a Democratic president is slapping on a tax to the middle class, to everybody. But
and if the tax were going to pay for health care reform, I wouldn't be opposed. But I'm just I'm just not sure that this tax is going to be one of the things that's going to help pay for this health plan.
I think if we were guaranteed and we saw it and we all knew it was for sure and we could trust what our government says, you know, all the time, I really don't think too many people would be opposed to this tax, because it's supporting the community at large.
I just think it wasn't debated. It was added on at the last minute, and it's going to unfairly tax people who really don't need to be taxed anymore.
Right. I mean, yeah, the average person getting plastic surgery does not have disposable income like they once had. Even the very rich getting plastic surgery, they have to shuffle their money around in order to come up with it.
Not only that, there's also a very fine line, and it's difficult to differentiate between what's reconstructive surgery and what's plastic surgery. And I have a lot of patients, cancer patients, who go in and get their breast reconstruction, and just to make themselves feel better, because they've been wanting it for their whole life, they go ahead and they get the tummy tuck at the same time. So they're ending one unhappy chapter of the breast cancer, and then they're going forward and doing something great for themselves. Maybe it's an eyelid tuck, maybe it's a tummy tuck. How are you going to differentiate?
Or what if one breast gets the cancer and that breast needs an implant, but then the other breast is small and flabby? Are they allowed to get a tax on the healthy breast? I mean, who's going to...
It's complicated, because some insurance companies will cover that asymmetric procedure on the other breast, but some will not. So, or what about a child who has a deformed breast and needs, we talked about this before on this show, and needs a breast reconstruction.
What are those called?
Strawberry hemangiomas, with a birthmark or a nevus.
Or a teenager that wants the birthmark removed, That to me is
or a breast reduction.
So breast reduction is health.
Anyway, basically it's unclear how this tax is going to be levied, how it's going to be made fair, and I think there are more opportunities for it to be unfair. So I'm a little angry about it, as you can imagine. I'm sorry.
I'm sure, because you are a doctor that works for your patients. So of course you're upset for your for not just yours but all plastic surgery and reconstructive
Like
patients.
I said, I would be an advocate for this tax if I knew where it was going to, if I knew
and if
it was
clearly
fair,
defined.
and if it were clear. But right now, just adding it on at the last minute is.
But it's not being added on because it's sloppily done, and nobody knows what the definition, what the
we'll see.
lines are going to be that are drawn in the sand. So far we don't have to worry about it.
Okay.
But if it does go through, I think, this is Santa Fe, it's a very political town. People speak up, because what you really want is not necessarily for the tax to go away, but for us to be assured that the tax will go to something that will benefit everybody, which is universal health care, as well as have the lines drawn in the sand clearly as to what situations get taxed and what do not.
Exactly.
Because as we all know, breast cancer is on the rise in this country, and that's just a cruel, cruel thing to say, sorry, you have to pay for your left breast with a tax, but your right breast won't be taxed. Unacceptable.
And eyelid surgery is another common one. A lot of insurance companies will pay for an upper eyelid lift because
blocks the vision.
If you can't see, but then somebody who gets their upper eyelids done is going to have an unbalanced face, and they realize, well, maybe I should get my lowers done too, and I'll pay for that because they don't want the facial imbalance.
I think that's a fair tax then on the lower. That to me is very obvious.
But you can't figure out which to tax and which not. Are they also going to tax?
You're going to have to charge them
insurance
separate
part?
procedures.
Yeah, okay. I mean, I think that's just going to have the patient and the doctor and the hospital and the staff just take one extra step.
Right. Nobody wants to do that because it's, we all take too many extra steps as it is these days.
Right. We just want to take care of our patients.
Right.
Rather than having
and the patients just want to get their stuff done, of course. I know. Listen, I don't know. I know, but I don't know. I'm not going to air my personal opinions on anything on this radio.
Okay, so that's the Botax, and you've heard my opinion of it, and I just wish it were awarded better, and hopefully it will be.
Again, right, this is just preliminary. I think they threw that out there in a hysterical moment. And
I'm not sure. Maybe, hopefully you're right.
They can't introduce something sloppy.
All right.
Okay.
Anyway, we're going to take a little break. Coming back, we're going to listen to Scott Thomas talk about invocation in this holiday season.
And we're going to talk.
Means.
Yeah, he's excellent. And we're going to talk about your artificial study, which is awesome, and you're privileged to get to do that.
Okay.
And we're also going to talk about actually something you did to my jaw, my face, which I've been wanting for since I was aware of whether I thought I was attractive or not when I was a kid. But they didn't make it back then. Yeah. So we did it with Radius, actually, not Arterfill. We did it with Radius. And that's interesting. And we'll talk about that when we come right back.
Okay.